I just want to basically mention that, we had announced our partnership with Adagio Therapeutics, who are actually developing a broad spectrum antibody drug to treat and use prophylactically for COVID-19. And I think what is interesting is that Adagio have just announced that their antibody actually neutralizes all the variants that have been discovered so far, including Omicron. And this is not the case with other, antibody prep, which I think is very good news for Adagio and for us, of course, because we are actually going to be making this antibody for India and many, many emerging markets. Well, the trial is still ongoing. It will be available as soon as it's approved. But suffice to say that, we will be in a position to provide this antibody, hopefully if it gets approved, anytime early to mid next year, we are ready with the antibody. So I just think that, every variant actually causes this kind of panic and hysteria. And I do believe that, we need to look at these new variants very differently in different parts of the world based on the level of vaccination. Because we clearly know that vaccination is muting variants. So whilst the reinfection rates might, certainly happen, we need to really focus on data concerning severity of the disease and mortality. And from all the kind of reports that we hear thus far, it appears that even in South Africa, they're reporting mild cases of COVID-19. And you must remember that South Africa is very under-vaccinated. And also, I think we must remember that even many parts of Europe that are reporting this particular Omicron virus, the variant, are also areas where there has been a huge anti-vax backlash, Netherlands, even in Germany, et cetera, et cetera. So I think we need to basically corroborate data of vaccination and the variant and the severity of the disease before we start all these very drastic measures that every country is taking. And I, for one, believe that actually just imposing lockdowns is not going to prevent the variant from spreading. It's vaccination that will help us to deal with these new variants. And this is not the last variant. We are going to have many more mutants and many more variants. So I just think we need to deal with this disease in a much more pragmatic way. And I really think that it needs to be led by science. The present vaccines will protect you to a certain extent, but, in terms of severity of the disease, but they may not protect you from getting infected. We have seen that many of these vaccines have not protected people against reinfection. You've seen that in Israel. You've seen that in many parts of the world. And Omicron is no different. So I just believe that I'm not even, trying to say that we don't have data about transmission. I think it is very transmissible. I think they're already saying that it may be more transmissible than Delta variant. But the fact is, let me ask you one question. The Delta variant was largely present in India and other parts of the, this part of the world, right? But very soon, Delta found its way around the world. And today, Delta is the dominant variant around the world. So and you can see that even though it's reached the US, I think Delta has not really had that kind of a devastating impact that it had in unvaccinated people. Well, I certainly agree with the virologists. I really believe that the higher the level of vaccination in any country, the lower will be the kind of severity of disease. And I think that's the data we should be actually sharing. We should be actually talking about the impact of Omicron on people, whether they are vaccinated, not vaccinated, whether it's a severe symptoms, whether it's moderate symptoms, mild symptoms. I don't think any of this data is really known in a very comprehensive way at the moment. So, okay, whilst it's better to be safe than sorry, I really, look at some of the protocols that the government is hurriedly coming up with, and I don't blame them because that's what's happening around the world. But is it really going to prevent Omicron from entering our shores is the question, Even if you basically test everyone at the airport, I mean, this is, I think, harassment because, most of these passengers have taken long journeys, sometimes 20-hour journeys. They're arriving in the country and they have to spend another 5 to 6 hours getting their test reports. And I worry that if you do these mass kind of, testing at airports in an enclosed space, even if you have a distancing between the chairs, I mean, aren't you putting even uninfected people at grave risk? So I just feel that testing is very important, but I think it's about really tracking the people who have been tested, and those who are positive definitely need to be controlled. But those who are negative, I think you can allow them to, have an easier life. I think this is a question we need to ask the whole world. I don't think it's just about India. I think the whole world is still in a state of panic. We don't seem to have learned enough about this virus or disease management or preparedness or how to deal with any variant. I mean, I'm really surprised that we are reacting in this way because I don't think we should be, reacting with the paranoia and panic. I really think we need to actually respond in a much more, pragmatic way with a better sense of preparedness. Otherwise, all the things we've talked about over the last several months about vaccination, about, testing, about antibody treatments, about other kinds of treatments is then not making any sense.